good day to all, and thank you for spending some time learning about Medicare. My guess is I looked over the attendees list, the registration list, and there are people from pretty much every state and quite a variety of occupations. So some of you, I think, will be using this information in your work as a CSA, your work with seniors, and I would suspect some of you might be one of the many 10,000 people a day turning 65 in this country or about to turn 65, and perhaps this is information for you. Regardless, I'll give you a nice overview of Medicare and help you understand a little bit about how to work with your clients if you want to help them make the decision of what makes best sense for them Medicare-wise. I have been working in Medicare for 9 years, which just means that I've spent some time trying to understand this really complex subject. The main point of me telling you about my background is that I was with the Colorado SHIP program for 8 years, 5 years as administrator of the state program. The reason I mention that is SHIP is a very, very important resource for everyone. There is a SHIP in every state. SHIP stands for State Health Insurance Assistance Program, or SHIP. I know that the A is missing, and it's not the same name in every state. If you're in Florida, your SHIP program is called SHINE. If you're in Georgia, it's Georgia Cares. If you're in Washington State, it's SHIBA. So it may have a different name than SHIP, but it is a SHIP program. This is a grant-funded program by Medicare. Medicare does not have feet on the ground in every state. They don't have a staff that can counsel people. So they provide this SHIP grant to every state. It either goes to the Division of Insurance or Department of Aging in your state. And then their job is to find people all over the state who will sit toe-to-toe with people and counsel, help them understand. So SHIP counselors will do Medicare 101 presentations, they'll do counseling, they can answer your questions. So to find the SHIP in your state, go to www.shiptalk.org or www.medicare.gov and find a SHIP counselor in your state, and they can be a wonderful resource. Before we get started, with every seminar that I do, I like to start with these three things. First of all, the big secret, the answer to every Medicare question, and pretty much every question in the world is, it depends. It really makes a difference. Your situation will make a difference in how you choose Medicare products and how you use Medicare. So it really, really depends on your situation, your lifestyle, your interests, how you're going to use Medicare. And it often is not the same for a couple. I've had several couples come and they've gone different routes with their Medicare based upon their needs. The other thing I say is everything I say is valid as of 2/19/2015 at 12:08 p.m. Mountain Time, and tomorrow all bets are off. And I do that to break the ice a little bit and to have people laugh, but also to make people realize that Medicare is a product of legislation, and therefore legislation changes. So it depends on how legislators get lobbied and by whom, and what the citizens say, their voters, as to how Medicare laws are going to be made. And once Medicare law is made, then Centers for Medicare and Medicaid Services, CMS, administers it. So CMS doesn't make the rules, they're just the administration. Really, in the 9 years that I've been doing Medicare, the structure of Medicare has not changed much at all. The biggest change was 2006 when I was getting started, and that was Medicare Part D coming in to cover prescription drugs. So don't worry, the sky is not falling and it's not changing rapidly, but there are adjustments. And then the third thing I say when I do seminars is there hasn't been a day in the last 9 years that I haven't gotten a question I can't answer right away off the top of my head. Medicare is very complex, and it's likely I'll get a question today that will require some research because it's very complex. There's lots of rules. There are exceptions for every rules. But I also say this when I start a seminar to make people feel comfortable that oh, it's okay that this seems confusing to me. It's okay that I don't understand this complex subject. Generally, you only have to learn it once in your life, and if your time hasn't come, you shouldn't know about this. So it's okay. Put people at ease. It really, it does depend, and all you need to know is how to find the right resource to look up the question, find the answer. So let's get started in here, and okay. Your clients. So everyone, including you guys, everyone faces the Medicare decision at some point in their lives if they live to be 65. So what you can do as a CSA is to help them understand the basic choices and the options, maybe point them to resources, someone who can help them counsel. You will be a hero in their eyes for helping them make the best choice for their needs. People are so grateful when they have gotten some kind of understanding about what makes sense or for them specifically. And so and I want to be this guy on the slide, happy and drinking a coconut drink, a pineapple drink rather. But you know, that's your goal, is to make your client happy and relaxed and feeling like they've made the best choice that suits their needs. So let's get into a little bit about what is Medicare. So who is covered by Medicare? Who? Those over the age of 65. Over 80% of people on Medicare are over 65. There are a number of people under 65 that are on Medicare, and they get there, unfortunately, with an illness or a disability. So ALS, Lou Gehrig's disease, end-stage renal disease, which is ESRD, is the abbreviation, and those who have been on Social Security Disability, SSDI, for 2 years. So you may be working with people who are coming on new to Medicare based upon an illness or a disease. I also mentioned that it's a U.S. citizen or lawfully admitted resident alien for 5 years. So someone who is an illegal alien in the United States does not get Medicare. It's just citizens and lawfully admitted resident aliens. Who can delay Medicare? A lot of people, when I'm doing presentations, will raise their hand before I get to this slide and say, but I'm still working, and that is a big issue nowadays. The Social Security full retirement age now is 66 for people retiring right now, and yet Medicare is still the first day of the month that you turn 65, unless you turn 65 on the first day and then it's the month prior. So there are quite a few people who are not taking Social Security yet and are still working full-time or are covered by a spouse that is working full-time, or at least enough to get employee coverage. And they can delay their Medicare. They don't have to take Medicare A and B. We usually recommend that they go ahead and sign up for A, but delay B because B costs money, and therefore you don't need to be spending money on Medicare when you have an active employee plan. So there is an exception on that. If you have what's called a high deductible account with a health savings account, you cannot sign up for any part of Medicare A or B and still contribute to that account. So if you're an active employee and turning 65 and you have an HSA, you should seek some counseling on that issue. It also has to be a group over 20, so an employee group over 20. The employee group remains primary and Medicare is secondary. And so a lot of people say, well, great, then if Medicare is secondary, it'll pick up my deductible and my copays. That is not true. Medicare looks at a procedure and the cost, the Medicare allowed amount for that procedure, and if the employee plan has already paid more than Medicare would pay for that procedure, which is usually the case, then Medicare will not contribute at all. So there's no reason to have Medicare Part B and be paying a premium for it. So you don't need to take it. If it's a group under 20, then yes, Medicare is primary. If you're covered under an employer group and because of disability, for instance, perhaps you're disabled and your spouse is the one that's still working and has the active employee coverage, the rules go to 100. If it's an employer group under 100, then Medicare is primary and you need to sign up. Now, this doesn't apply to COBRA. This is a big issue. People will come off onto COBRA from an employee plan and say, gosh, I really liked COBRA. I'll just stay with it and I won't get Medicare. Well, Medicare does not consider that creditable coverage. So if you're on COBRA, you'll need Medicare A and B. If you're on a retirement plan, you need A and B. Retiree plans are not active employee plans. And this doesn't apply to those on Medicaid. They must enroll in Medicare when they're eligible. Medicare is the primary coverage. Medicaid is always a payer of last resort, and they'll want you to be on Medicare and Medicare Part D. Now, this you'll hear quite a bit. I understand, people will say, I heard that Medicare is automatic. Aren't I automatically signed up? Well, the answer is, again, it depends. If you're already taking Social Security benefits at age 65, you'll automatically get a card in the mail a couple months before your birth month. If you don't, and it's a month before your birth month, then you should call Social Security. Make sure you're in the system. If you're not taking any Social Security benefits yet, you must contact Social Security, raise your hand, and let them know you're turning 65. How do you do that? There are 3 ways. You can go to ssa.gov, online services. There's a little computer monitor screen in the middle there. Online services, sign up for benefits, sign up for Medicare only. That is certainly the easiest way to do it. Now, if you're someone who already has Part A, you're now 68 years old and you're just leaving your employee coverage and you want to kickstart your Part B, you cannot do it this way. You have to call Social Security. They're going to send you some forms you have to fill out. So the second way would be, if you don't want to do it online, and that certainly is the easiest nowadays, is to call Social Security, have a book and a glass of water, or be able to put your phone on speakerphone and multitask, because you're going to wait an hour, a good hour, to get someone to answer the phone. A lot of times now they'll offer to call you back, and that works out really well. If they say they'll call you back in 15 minutes, it will be within a couple minutes either side of that. The third way would be to go to your local Social Security office. So with sequestration and budget cuts and 10,000 people turning 65 a day, there are long waits at the Social Security office line. It's certainly much less brain damage to do it online or by telephone. What does Medicare cost? Premiums. Part A, a lot of people will say, oh, Part A is free. Well, that's not exactly right. Everybody who has a paycheck or has ever had a paycheck and saw that little gremlin FICA, F-I-C-A, that eats a big chunk of your paycheck, well, that's your Social Security contribution and your Medicare contribution. So it's paid, I call it prepaid, paid in advance. So when you hit the Medicare age and you want to sign up for Part A, you do not have to pay for it if you or a spouse, you can hitchhike off your spouse's record, worked and paid into Social Security for 40 quarters. Others can purchase if somebody didn't have the 40 quarters. Very few, less than 1% of people on Medicare have to buy into it. Part B, as in boy, everyone pays a premium except for the lowest income people with Medicaid. It's $104.90 in 2013, 2014, and 2015. It hasn't changed the last 3 years, and that's for most people, again, over 90%. If you're lucky enough to have income more than $85,000 as a single, $170,000 as a couple, you will pay a higher monthly premium, a means-tested premium, and that will change every year based upon your tax records. So income goes up and down. Medicare has 2 parts, Part A, Part B. We talked about Part A, no premium. Part A is hospital stays, and there is a deductible. So if you are inpatient, you are admitted to a hospital for at least 1 day, 1 night, you will pay $1,260 as your deductible, and then for the rest of the 60 days, you're good. You don't have any additional copays. You can see that there are higher costs if you stay longer than 60 days. If you are going into the emergency room and under observation, you are not admitted. That's all Part B. So Part B is hospital, ambulance, surgeons, all of those things. For Part B, you have an annual deductible, $147 in 2015. So that's the first service that you have in the first month or after you get Medicare. And then after that, Medicare pays 80% for services and you pay 20% coinsurance or copayment for services. So my whole business, everything I do, is based around capping that 20%. Because 20% of a doctor visit, not a big deal. 20% of chemotherapy, kidney dialysis, joint replacement, brain surgery, that's a big deal. That 20% can pretty much derail your financial plan and, change your lifestyle. So capping the 20%, that's what you need to pass along to your clients, and if this is for you, to consider for yourself. So how do you cap that 20%? The first way is by picking up an additional product on top of Medicare called a Medicare supplement or a Medigap. These were standardized by federal law. Congress created the structure of the Medigap, and they're regulated by whatever state you're in, the Division of Insurance, sold by private companies. So the companies you've heard all your life, Mutual of Omaha, Blue Cross Blue Shield, United Healthcare, Humana, Aetna, Cigna, they all offer Medicare supplements. These cover the gaps in the original Medicare plan, so I'll bounce back and say, what are the gaps? The Part A deductible, they can cover that. The Part B deductible, cover that, and that 20%. In fact, there are several types of plans, or several lettered plans, to add to the confusion. You've got Medicare Part A, Part B, Part C, Part D, but you also have Medigap plans A, B, C, D, F, etc. Plan F is what I usually use as a good example because it's the most comprehensive. So Plan F picks up your Part A deductible, your Part B deductible, and that 20%. It caps it at 100%. There's hardly any insurance, I'm not aware of any insurance in the country anymore, even great employee insurance, where you don't have some deductibles and some copays. With Plan F, you have no medical costs. It picks up the Part A, the Part B deductible, and the 20%. It's really great. Of those standardized plans, there are exceptions. They are not the same standardized plans all over the nation, are different in Massachusetts, Minnesota, and Wisconsin. So if you're in one of those states, contact your local division of insurance or go to www.medicare.gov and pick up the publication Choosing a Medigap, and you'll have information on how those plans work in those states. So Medicare supplement can be really comprehensive coverage. Of course, it costs money. These are private companies. It's different in every state. Medigaps are priced by zip code, male, female, your age, they go up as you get older, and smoker, non-smoker. So it's hard to even give a sample Medigap price, but I'll tell you, sitting in Denver, Colorado, somebody turning 65, male or female, could pick up a Plan F, the most comprehensive one, for about $150 a month and have that full coverage. So that's just a shoot-at price. I was on a webinar a couple of days ago and saw that New York has higher prices. They're more in the 200s. Florida has some higher prices. So it depends on where you live and what your zip code is and the cost of doing business, the cost basically of providing health services in that state. The second way that you can cap the 20% is through something called Medicare Advantage. So those are your managed care plans, HMO, PPO, PFFS. HMO, Health Maintenance Organization, PPO, Preferred Provider Organization, PFFS is private fee-for-service. Those plans are slowly going away. There's not a lot of those left. Mostly it's the HMO, PPO. So what is this? This is a managed care plan. It's your Part A, your Part B, and usually your Part D drug plan all wrapped up into one nice, neat package. It pays instead of Medicare. So it has its own rules. Medicare, what happens is when you join an HMO or PPO, Medicare hands over a flat fee, a capitated rate for you for the month. They get this rate for you whether you go see the doctor or you don't go see the doctor. So their incentives are to push health, give you gym memberships, a lot of preventive services and things like that. If they can manage your health and keep you healthy, they can keep more of that money, that capitated amount they're getting per month. So there are networks. You generally must receive all your Medicare covered services through the plan. Usually you have to see the primary care doctor to get a referral. They're all different, but these are the general rules. If you're living in small town America, these are probably not available to you. They have to have a big enough network where they can get doctors of every type that they need and put them in the network and try to drive down costs. So Denver metro area in Colorado, these are very available. If you live in Yuma, Colorado, out on the plains, you're not going to get one of these plans. Now, how do these cap the 20%? You pay a monthly premium for these. Generally, it's $0 to $50, maybe $100, lower monthly premium than the Medicare supplement, but you'll pay copays for every service, but they have an out-of-pocket medical maximum. So that caps that 20% liability. So going back to Plan F, where it caps the liability at 0, Plan F covers it all. There's no out-of-pocket, so there's no out-of-pocket maximum. These plans, you would pay copays for every service you get, but the out-of-pocket maximum would cap that 20%. And they go from, in Colorado, it's around $4,000 to $6,000 is your out-of-pocket maximum for the year. So even in the worst-case scenario, that's how much you pay for medical services, not your prescription drugs, and then you wouldn't pay any more. These plans also throw in some extra added benefits because they want your business. They want you to come in. So prescription drugs, vision, hearing, they'll have extra plans, sometimes extra dollars. One of the most common things I hear when people come to me to talk about Medicare is, I want a plan that covers dental. I hear it all the time. Well, Medicare doesn't cover dental, period. It doesn't cover dental. So the Medicare plus a supplement is not going to cover dental because a supplement just pays after Medicare. It's a secondary payer. It's not going to have that kind of additional benefit. Now, Congress did allow, these plans are standardized, so a Plan F is a Plan F no matter what area you're in and no matter what company. Congress did say these Medicare supplements can start adding on value-added benefits that don't relate to that. So they could start adding those dental plans on, but I haven't seen one yet. If somebody knows of a dental plan attached to a Medigap in their state, send in a little note to Erica so we can see that later on. The Medicare Advantage plans do. In Colorado, there's United Healthcare, AARP, Medicare Complete, offered by Secure Horizons, otherwise known as United Healthcare, and they have an added benefit for dental, but they charge about $14 a month for it. So it depends on the plan. Every plan is different. I'm giving you the broad overview. I can't give you the specifics for every area in the country. This is the main slide of our whole presentation. There is a chart in Medicare and You and a chart in choosing a Medigap policy that's like this. It's the Medicare flow chart, and it'll show left side, original Medicare Parts A and B, plus a Medicare supplement. Now, you don't have to pick up one. You could just have A and B and have that unfunded, unlimited 20% liability. Or most people will pick up a Medicare supplement and then a standalone Part D prescription drug plan because the Medicare supplements don't cover drugs. Or the option is the Medicare Advantage plans. That's the Part C, wrapped up your A, B, and D. Now remember, Medicare pays, if you join a Medicare Advantage plan, Medicare pays that plan a flat capitated rate per month to manage your care. And then Medicare doesn't pay your bills anymore. So you can't have an HMO and then say, oh, but I just got diagnosed with cancer and I want to go to the best doctor in the country, MD Arthur Anderson in Texas. This guy is the best treating this disease. You cannot divorce yourself from the Part B and go have Medicare pay. So it's either or. If you're original Medicare, you have the flexibility of going anywhere in the country as long as the doctor accepts Medicare. So this is the key slide, the key concept that people have to understand when they're coming on to Medicare, is that there are two ways to get your Medicare, and they are very different, and there are pros and cons for each. So let's go over a little bit of that. Medigap can cover 100% of the Medicare deductibles in coinsurance Plan F, leaving no out-of-pocket for medical. You use original Medicare and the Medigap anywhere in the country, any doctor that accepts original Medicare. If you go out of country, by the way, Medicare doesn't cover you. The Medigap has a little added benefit for emergency travel, foreign travel. You don't need any referrals for specialists. It's a peace of mind plan. Everything is covered. It's also predictable. Whatever your Medicare supplement monthly premium is what you're going to pay. You don't have to worry about additional copays usually, depending upon the plan, or additional out-of-pocket expenses. So it's very predictable. It's like best case, worst case scenario for the year. This is what I pay, and that's it. Drawbacks to a Medigap: you must find a primary care doctor who accepts Medicare and is taking new patients, and I hear more and more talk about that. I have not found any problems in the Denver metro area helping people find a doctor. It may take a few calls. I reached some groups that were not taking new patients because one of their doctors had retired and they were trying to assimilate that doctor's people into the practice, so they were closed to new patients for a while. But it's not impossible in the Denver metro area. There is no list of all doctors who accept Medicare. You can go to Medicare.gov. On the front home screen on the left side it says find a doctor. Put in your zip code, put in the parameters of what you want within a certain mile, a female doctor, an internal doctor, and it will pop up a list of those accepting or that are getting Medicare payments. And if you call them, then they may not be accepting new patients at this point in time, but you know that they accept Medicare. The premiums are set. That could be a drawback or a positive. It's going to be over $100. Remember, I said in the Denver metro area, if you're turning 65 and you want a good, solid United Healthcare Plan F, chances are you'll pay about $150 a month. So you pay the same whether you use the medical services or not. Some people will say, well, I'm really healthy. I go to the doctor twice a year, maybe once a year. For my preventive, I'm not going to pay $150 a month. Plus a drug plan, which in Colorado would be another average $30 a month. So $180 a month just to have coverage, and I don't think I'll use that. I'd rather save my money. So you will hear people say that, and that's a good option. For them, a zero premium Medicare Advantage plan might be a better choice. They'll risk having to pay the copays, and if they have a bad year and they hit their out-of-pocket max, well, so be it. They've made that risk. Premiums will go up as you age, so the older you get, the more it costs the company to insure you, to provide services for you. Therefore, they'll pass more costs on to you. So if you're in 70 plus in Colorado, it's going to be in the Denver metro area, $230, $240 to have a Medigap. And again, as I mentioned, there are usually no extra benefits such as dental, vision, hearing, gym memberships. It's just a flat secondary payer. They don't look at where you go, what the procedure was. They say, you went to the doctor on this day, Medicare says it was worth this much, Medicare paid 80%, we pay 20%. Benefits of an Advantage plan. You have a network of doctors to choose from. So if you move new to some place, Denver, Colorado, and you cannot find a doctor to accept you new with Medicare, if you join an Advantage plan, you're going to get a doctor. They guarantee you'll find a doctor. So do doctors have to take Medicare? That's a question I get a lot. They don't have to, and they're not required by law. They can accept all Medicare patients. They can opt out of Medicare and accept nobody with Medicare, or they could say, I will keep you, Liz, because you've been my client for my patient for years and years, but this other friend of yours that just came to town, nope, I don't have any room for new patients. The Advantage plans add these extra benefits such as dental, vision, hearing, gym memberships. Why do you think they add a gym membership? Remember, the Advantage plan is getting paid whether you go to the doctor or not. So what's their Advantage? What's their desire? To keep you healthy and to keep your preventive services up so that you don't cost them a lot with a major medical. So they're going to often pass along a gym membership at Silver Sneakers. A lot of people come to me and say, I want a plan that includes Silver Sneakers. Well, that's the equivalent of about a $30, $35 gym membership. It covers professional gyms such as in Colorado 24-Hour Fitness, and Bally's just got bought by 24-Hour Fitness, and your local rec center and Curves and Planet Fitness is another name. So you can go to silversneakers.com if you want to see which gym memberships you would be able to get for free. That's a pretty good deal. The Advantage plans have low or no monthly premium. There are several zero premium plans in Colorado. You still have to pay the Part B monthly premium. You don't get away from that. So either side, left side, right side, you're going to pay your Part B premium. But above that Part B premium, on the left side of the equation, you would have a Medigap, $150-ish, plus a drug plan, $30-ish, so $180. With an Advantage plan, you can get a zero premium. And they have some with higher premiums that have lower out-of-pocket maximums, so it's a trade-off, but you'll have to go either way. Now, with Advantage plans, you cannot be turned down unless you have end-stage renal disease or kidney failure. And what that means is if you are already on the plan and you develop kidney failure, they will keep you and pay for your kidney dialysis, although you'll owe 20%. If you get end-stage renal disease, then you can't switch to a different Advantage plan. And if you have it already when you walk in the door and want an Advantage plan, you can't get it. Now, these are the plans that you see the October 15th through December 7th annual enrollment period. That's the plans that you can switch up. The standalone prescription drug plans are managed, if you will, or the oversight is with CMS, Centers for Medicare and Medicaid Services. Same with the Advantage plan. So they contract essentially with Medicare to provide these plans, and Medicare makes them have this open enrollment period and switch around. If you're outside of the annual enrollment period, generally you can't switch plans. You must wait. And of course that depends as well. There are exceptions to every rule and exceptions to that rule too, especially if you're low income. Drawback to Advantage plans. There are restrictions as to who you can see. Generally, you must stay in the network for HMO. PPO allows you to go out of network, but you're going to pay a much higher price. So remember that scenario. Someone's in an Advantage plan in Denver, Colorado, and they develop cancer, and there is a really hot doctor at MD Arthur Anderson in Texas that treats that disease the best. You can't necessarily go there. You can ask your Advantage plan if they'll let you go out of network to see that doctor. Chances are they'll say no, that they would have somebody within the network that could provide the care for you. If you have a PPO, of course, you could step out of network. You would pay generally 40% of the cost, so it'd be higher than Medicare alone. Plans limit costs by limiting the providers you can see, so you can't choose any doctor or specialist you want to see. It has to be in network, and doctors generally have certain specialists that they refer to. So a little bit more restrictions, but less money per month. So how do you choose the best plan? This is the crux of what we want to talk about. When you're sitting there turning 65 and you have these unlimited options, so when you're 65 you get guarantee issue, cannot be turned down no matter what your health underwriting is or what your health is, for the Medicare supplement or the Medicare Advantage plan. It's crystal ball time, I like to call it. This is when you sit there and say, okay, what's in my future? What happened to my parents? What were their health issues? What's happening to your siblings? What is your health? What have you done to your body? What is likely for your future? Because you want to make a good decision now, because you are limited in your options in the future. Now, how are you limited? With the Medicare Advantage plans, no matter which one you pick, you do have a chance every October 7th through October 15th through December 7th to switch it up and pick a different Advantage plan. That is true. So if you're unhappy in your choice, you can switch. But the Advantage plans all have about the same structure. They're going to have copays for every services. As a general rule, it's a set copay like $20 to go to the doctor, $50 for a specialist. But when you go up to the higher priced items, chemotherapy and kidney dialysis, durable medical equipment, you want a scooter, those things, they're required to give you as much service as Medicare, as much benefit, but no more. So they will often ask you to pay 20%. And that's when you eat into that out-of-pocket maximum pretty quick. 20% of chemotherapy can be a lot of money. So if you have Medicare A and B and nothing more, and you are diagnosed with cancer, and you're going to be taking Afinitor, which is a hot new cancer drug, it's $10,000 a month. So if you have it at the doctor's office, that's an infusion or an injection at the doctor's office, that is a Part B service. So you pay 20%. So $2,000 would be your cost per month, and that's every month. There's no cap on that. So that would be $24,000 if you had to be on Afinitor for a whole year, which I understand people are on it usually about 2 years. So that's a lot of money. That's $24,000. If you have the Medicare Supplement Plan F for Afinitor, you would pay nothing. The 20% would be covered. So that would be a really good deal if you had a horrible disease like cancer. If you're on an Advantage plan, you're going to pay 20%, so you'll pay that $2,000 a month, but it would be capped. So let's say you had a plan with a $6,000 out-of-pocket maximum, you would be capped. You'd pay for 3 months, $2,000 times 3 months, and then you'd be capped. So it's not as devastating as just having Medicare Part A and B alone. Couple other notes about how to choose the best plan. This is my little slogan, there is no we in Medicare. People are very accustomed to choosing the same plan as their spouse. So they'll come into your office and say, well, my husband and I, want to choose a plan together. Well, there is really little advantage to do so. Maybe the ease of writing checks. You can get a multi-person household discount of a few percent. So United Healthcare supplement plans, if you and your spouse both take one, it's 5% discount. It certainly shouldn't be the reason that drives you to choose a plan. I've heard people say, I have a very good friend, knowing what I do, he said, oh, I'm just going to do what my friend does. And I said, great, what's your friend do? And he said, well, I don't really know. So that's not the way to make a Medicare decision. And a couple is choosing the same plan. It might be fine, it might not. I had a couple from Westminster, which is a suburb of Denver, come to me. The man was all bent over, his back was, I don't know what was wrong, scoliosis or injuries or whatever. He was quite bent over, lots of back issues, had oxygen, has asthma, gets MRIs frequently. An MRI or a CAT scan is a major medical cost, so you're going to pay 20% of it if you're on an Advantage plan or if you're on Medicare. And 20%, it might be $300, $400, $500. If you had to do that every month or every other month, that's a lot of money. His wife, on the other hand, was very healthy, had a family that was very healthy. She didn't have anything in her future that she could predict that she'd be a big user of health care. So when they left my office, he went with a Plan F to be completely covered at $150 a month for medical. He knew exactly what he'd be paying per month, no matter how many CAT scans, MRIs he had, or hospitalizations. His wife took a zero premium Medicare Advantage plan. She was all about the silver sneakers. She got silver sneakers, and off they went, and that's probably a good choice for them. Now, could she have a major illness and be smacked tomorrow and be in the hospital for days and days and have hit her out-of-pocket maximum? Sure, she could. But the chances are she's going to save money over time. If she goes 5 years having very few services and then gets smacked with an out-of-pocket maximum, she's probably still saved money. So it really depends on the customer, and it should be a consideration for couples to make individually to see if their needs are different. These are complicated choices, so how do you help a client figure out what's best for them? Gather all the information on all the options. Many people are still on employee plans and are wondering, I'm turning 65, should I just stick with my employee plan? That's one consideration. They may have an attachment to a retiree plan, although those are going away very fast. Medicare. So sometimes I will sit down with a couple. I have a couple in Louisville, Colorado. He is an active employee of the city of Boulder. He can go on Boulder City retirement when he gets to that. He's about to retire. He has access into PARA, which is the Colorado State retiree plan. His wife is actively employed by the state, so she can take active employment through the state, or she can do PARA. So they were looking at all these 5 options and saying, oh my gosh, what to do. So we gathered all the plans. We sat down and figured out what made best sense for him and what makes best sense for her, because they were different options. Actually, she's the Affinitor lady, and is paying $10,000 a month for Affinitor, although she gets a discount, obviously, through her employee plan. So you ask a lot of questions and you listen for what they're saying. I've had a client say, young lady, I'm 59, he just turned 65, young lady, I will choose any doctor anywhere I want. So freedom of choice was important to him. He went with a Medicare supplement. It wasn't a big deal for him. He, with good financial choices, the $140 was the premium of the plan he chose, was nothing for him. So this is important for him. Other ones will say, I don't want to, even if you have lots of money, I don't want to pay $150 a month plus drug plan, $180 a month, because I don't think I'm going to use it. I will take that money and put it away. That's over $2,000 a year. I'll put it somewhere in something I can access, and if I have a bad year and have to pay a high out-of-pocket maximum, so be it. I've still made better choices. So it really depends on the person and their circumstances. I wasn't joking when I said the answer to every Medicare question is it depends. And your clients will decide for themselves. It's not a matter where you have to advise them or choose for them. You just have to point out all the options. Once you show them that flow chart, the left side, right side, and explain the pros and cons of the various plans, they'll say, I want freedom of choice. I'm going to live half a year in Yuma, Arizona, because it's warm down there, and it's supposed to snow a foot in Colorado this coming weekend. I don't want to be there anymore. So for them, the Advantage plan is not going to work, because all their primary care services have to be provided in the location which they're registered with Social Security. So if that's Colorado and they're in Arizona and they see a funny spot on their arm that they want to have a dermatologist checked out, so not an emergency, they're going to have to get on a plane and come back to Colorado to do that. It's possible. Do all your preventive and all your normal services here, and when you're in Arizona, just relax, and if you have an emergency, you'll be covered, but just for emergencies. So remember that either way you go with a client, whether you're talking with them about Medigap or Advantage, they're covered. They have good coverage. Advantage plans are good. Medicaps are good. People will often come to me and say, oh, this is so much information, so much choice. Just tell me the best plan. Well, the best for me is not the best for you, and it's not the best for your client, and sometimes it's not the best for their spouse. So it's very individualized, and helping them understand that flow chart is really, that's the most important thing to do. So what do? I got a Medicare and You book, and I also have the Choosing a Medigap book, and they both have that flow chart in it, and I open it up and show it to them and talk about that chart, because that is the main thing. Once they go from there, then you can get into either point them to someone who is an insurance agent and knows who the best companies are in town that have Medigaps, because it's different every state, and if Advantage plans are available and which ones are available in your state. You can find that out by going to www.medicare.gov, putting in a zip code and asking for health plans, and it'll give you a list of all the ones in your area. Or use your SHIP. The Colorado SHIP publishes a nice little newspaper every year with all the Advantage plans listed and all the standalone drug plans. Other states may have that as well. So again, just to recap, when you're working with your clients, who's going to lean towards a Medigap? If you're in a rural area, you don't have any options for Medicare Advantage. If you're planning to live more than one place during the year, the snowbirds. If you want to choose your own providers, if you already have difficult health issues and will require many expensive tests, if you just want peace of mind, I don't want to think about this ever again, I want to get a plan and stay on it forever, and I just want to know I'm covered no matter what happens. Who's going to lean toward the Advantage plan? Somebody that says, I already have a primary care doc and they won't take original Medicare. They'll only take me if I have this Advantage plan, so they're probably going to do that to keep that same doctor. Someone who wants those little extra bells and whistles. They want vision, they want silver sneakers. Somebody who likes one-stop shopping, everything's included in that same plan. You only have one phone number to call for all of your doctors. I am healthy and don't want to pay that higher monthly premium. Lower income clients, this is another subset. People who really only make $1,000 or $1,200 a month, $150 plus a $30 drug plan. Well, they would be on what's called extra help with Medicare Part D, but they would have to pay their copays, and they probably can't afford that $150 flat fee per month. They're going to have to risk not needing as much services, and that their copays will be less than $150. Medicare Part D, we haven't talked about this. This is a subject that could take its own hour. There are standalone plans which are for people with Medigap. They pick up a standalone prescription drug plan. The Advantage plans usually have it wrapped up. The best way, really the only way to pick a Part D plan is not through just putting your finger on a list and figuring out where your finger fell. You go to Medicare.gov, you enter your drugs, and it sorts and tells you the best plans in your area that cover the drugs that you take. And please encourage your clients to review that every year. The plans change coverage. They may change the drugs they cover. You may sail into the new year through inertia and not look at another, not bother to look and see what other plans are available. And you may be in trouble then when you find out that that expensive drug you take is no longer covered by your plan. Very easy search to do. If you're not comfortable with it, you can learn from a SHIP counselor. We do. When I was with SHIP, we did thousands of them a year. Okay. Employee retiree coverage versus Medicare. So I put my little caricature there because this is my experience, not something that you're going to have national articles on. People with large companies, the coverage is cheaper for the employee than Medicare. So somebody that's coming on to Medicare and could stay with their employee coverage, usually the employee is better off staying with the employee coverage. For the spouse, usually it's better the other way. Spouses usually have double the premiums of the employee, and if it's in Colorado, if a spouse is costing more than $300 for coverage, they could get Medicare plus a Medigap and have no deductibles, no copays. They could do better with Medicare. So it really depends, and you have to look at the company benefits to help them decide whether it makes sense to stay with the company plan or to go to Medicare. Now, sometimes a client who's the employed one who's covering a younger spouse who isn't yet on Medicare, and no, you cannot get Medicare through your spouse before age 65. You have to be 65 to get it. So if you need to stay on the employee plan to cover your spouse, sometimes that makes it worth it. Retiree coverage versus Medicare. Companies all over the United States are dropping retiree health coverage. Plans, companies I never thought would do it, Goodyear, IBM in Colorado, Johns Manville, companies like that have offered retiree health coverage in addition to their retiree pension are now dropping the health coverage and directing people to Medicare. So you have to have A and B anyway to be on a Medicare plan or retiree plan, I would recommend them going on Medicare, taking a good look. Now it is a very serious consideration because once you drop a retiree plan, you usually can't go back. So if you're covered by FEHB, Federal Employee Health Plan, and you decide to drop it and go to Medicare, you don't get to go back ever to FEHB. Generally, those government plans are still pretty good coverage. It's the smaller companies that their retiree coverage is just not very good anymore. It's a sign of the times, so almost always Medicare will be a better choice, certainly for the spouse. Remember, you can change your coverage if you have an Advantage plan, October 15th through December 7th, effective January 1. You can change your Part D plan, no health underwriting. They cannot turn you down no matter what drugs you take. They have to take you. Medigap plans are not subject to this period. I know somebody's out there raising their hand and screaming, but the Affordable Care Act said no pre-existing conditions anymore. Well, Medigap is private insurance, and Medicare was largely not affected by the Affordable Care Act. So no, that is not the situation. You must pass health underwriting. Great resources. So the best way I know to find something is to Google it. I know where the Medicare online manuals through cms.gov or ssa.gov that have Medicare coverage, but it usually takes less time for me to Google, does Medicare cover contact lens after keratosis, which was my question of yesterday I had to look up. It was faster to do it that way, and it actually leads you to the Medicare publication than it was to log into cms.gov, go for research, find the online manuals, and start clicking through manual chapters until I found it. It's a really good source. Just Google the question, does Medicare cover this? And there are lots of publications that you can use for yourself and with your clients at Medicare.gov. The best ones, Medicare and You, Choosing a Medigap Policy, Enrolling in Medicare. Those are great publications. Also, as I said at the very start of the webinar, your state's SHIP program, you can find them, and that's great resources. Your State Division of Insurance has Medigap information. State Department of Aging has great resources, and your local insurance agent, because they understand the products that are available in their area better than someone in a central location or another state. So questions? Thank you for your time and attention. This important subject. You can contact me. You see on the screen my email or through my website.
So first question up we have here, Liz. If you are self-employed, 66 and collecting Medicare, will your monthly amount increase as you continue to earn, or is it always just calculated from that earned amount by age 65?
Okay. Good question for 2 points. If you're self-employed and you're a group of one, you cannot get other coverage. You must be on Medicare, so you're hopefully not trying to get an individual health plan. But back to the question, so Medicare Part A, no charge. Medicare Part B, $104.90, is the same for everybody. But if you're talking about the means tested premiums, they're based upon your 2 years ago taxes. So right now Social Security is, I think, still using 2012 taxes, and they will base your premium for this year on your 2012 taxes. Next year, 2013, and go on. So you can call Social Security and challenge that. If you may had a really good year in 2012 and now you've stopped working, gotten divorced, and you're not making as much money, challenge them about the Part B premium. So it is based upon your taxes. They have some kind of magical interface. They go in and find out what you paid for taxes.
Next question we have here, when you sign up online, they still require you to go to the Social Security office. Why is that? This is what some of my clients have told me.
The answer to that, as all questions, is it depends. If you sign up online and you're signing up under your record, you worked 40 quarters, you probably will go right through. If you are collecting based upon a spouse record, you didn't have the 40 quarters, and your Medicare number then would be the spouse's Social Security number plus a B something, then you have to go to the Social Security office. If you've signed up for Part A already and you want to just enroll in B, you have to call or go to the Social Security office. So probably in the case of some of those clients, they have to take their husband's Social Security number down and get set up. So sometimes you do have to go to the office. If you cannot do the online enrollment, then I would call Social Security and find out what the situation is. So at least if you do have to go to the Social Security office, you'll know which documents to take along. Also, if you've taken your Part A and delayed your Part B because you're older, so you're now 67 or 68, Medicare wants to know why you didn't sign up for Medicare at 65. So there is a form, I can't remember the number, L469 or something like that, that they will send you that you have to take to your employer to prove why you had creditable coverage. So they may want you to, they'll mail you that form, or actually it's now available just starting like 2 weeks ago on the Medicare.gov website. You can pick up those forms to enroll in Medicare. or send me an email and I'll email them back to you.
Okay, next question. If under 65 and on COBRA through a former employer and Medicare due to ESRD, does Medicare remain secondary?
No. Medicare is usually primary, and again, that depends. ESRD is complicated, and there's a Medicare booklet on that. Medicare is primary in some situations, like if you go in for a transplant, the month you go in for the transplant, Medicare is primary. So it really depends on your situation and whether you're getting dialysis. It depends. So with that one, I would get some Medicare publications, make sure you're talking to your HR department, because it depends on the situation.
Okay, next, can a person combine their Medicare coverage and then have a state employee plan as their supplement?
No, not as a supplement in the term of supplement. If you're actively employed, you would have, with a company more than 20, then the company is primary and you don't need Medicare. If you have Medicare A and B, the company may wrap around and provide secondary coverage. It's not a supplement per se, but they may provide secondary coverage. It depends again on the size of the company. Now for state, you're probably talking either you're going to be active employee or you're going to be retired. So state of Colorado, for example, you could have Medicare A and B primary, and then the state of Colorado offers for retiree coverage. They offer a supplement type product through Blue Cross Blue Shield, and they also offer Kaiser and United Healthcare Medicare Advantage plans. So can it combine with your company insurance? Yes. Chances are Medicare plus a supplement outside of your company probably would be cheaper. It really depends on the company, but it's possible. I'm sorry to be so vague on these things, but it's just not black and white. You have to look at each individual person and their plan, what company, how many people, all of that to figure out who's going to be primary, who's going to be secondary. There is a great publication at Medicare.gov called Who Pays First, and that might help you figure that out.
Okay, with the state of medical insurance and the ACA, are you seeing a trend that fewer doctors are accepting Medicare?
So I am not. The Affordable Care Act does not affect Medicare. What happens, it doesn't affect it directly. What happens is doctors are getting busier, and you're finding more practices that just are not open to new people. But as to whether or not they accept Medicare, really that's more about the reimbursement. So Medicare reimburses doctors. Doctors complain about the reimbursement rate. All 9 years that I've been working in Medicare, every year there's been a projected reimbursement cut, 5%, 10%. Every year in 9 years it's been dropped. Congress responds to pressures from the doctors. So they really haven't had major cuts in the last couple years. There have been a couple percentages down, but they're also getting incentives for better health outcomes, incentives for electronic records and things like that. So so far I haven't seen in the state of Colorado, and someone might challenge me in another state, a major loss of Medicare providers. I'm hearing about doctors who are getting just tired of how insurance companies manage their practice by the rules, and they're just stop being doctors. It's happening. You heard a little bit. I'm not seeing a major issue.
In open enrollment period, can you switch from an Advantage plan to Medicap and vice versa?
So open enrollment period is the first time you get Medicare, and yes, you can. During that annual enrollment period, October 15th through December 7th, you can switch up your Part D plan, switch up your Advantage plan to any other Advantage plan, as long as you don't have end-stage renal disease, but you do not get guarantee issue into a Medicare supplement. These are not managed by Medicare. They're not part of that contract. They are private insurance companies like your car insurance, and if you went up to your new car insurance provider and said, oh, I've had 3 accidents this year and 4 DUIs, when they stopped laughing, they'd hold the door for you. No, they wouldn't accept you. So Medicare supplement, once you have chosen one, you've gone through you have 6 months after you get Medicare to pick up a Medicare supplement, guarantee issue, nobody can turn you down. There are some little exceptions to that. If when you are first 65, you try an Advantage plan first, that extends it to a year. You have a year to change. But after that, if you just wait, and this is, I heard a doctor in rural Colorado said, I'll just take a zero premium Advantage plan now. There was one available in his area. And 10 years from now, when my health tanks, then I'll go get a supplement. And I said, if you can figure the day before you have a heart attack or some major diagnosis of cancer and you get a supplement, great. But if you wait until after you've been diagnosed with something difficult, you probably won't get a supplement. So that's a very common misconception that that annual enrollment period means you can switch anything with guarantee issue, and the answer is no, not with a Medigap.
Okay, next question. What happens if the person had a kidney transplant 15 years ago, is in great health, now will turn 65 in 1 year?
That's fine. They can get a Medicare supplement. If they do it during the guarantee issue period, nobody can turn them down. If they're not in their guarantee issue period, they probably still will be accepted because that issue has been done and treated and it's done. They look at more the most recent history, like the last couple of years, to see what's going on.
Okay, generally Plan G is more cost effective than Plan F, is it not?
I agree. Plan G, the only thing I didn't show a Medigap chart. You need to pick up a chart from CMS and look at it. Plan G, the only thing that it doesn't cover is that 147 Part B deductible. So if the premiums are less than the cost of that deductible, wait a minute. Yeah, if they're less than the cost of that deductible, then you've got a better deal. I'm not saying that right. So if your premium is $20 or less a month for Plan G, that's $240 a year, and you have the Medicare Part B deductible that you have to pay is $147, you've still saved a few dollars. And Plan G will be good until Congress decides to up the Medicare Part B deductible, and then the G might not be the very best deal. I use G because it's the most comprehensive, but F is a really good plan, N is a very interesting plan, C is a pretty good plan. There are some options that will whittle away a little bit at your premium, but you have some co-pays there, you have some liability. So Plan G is a good one to look at.
Okay, in this question, I have a client that turned 65 in December. She wants to retire April 1st, 2015. Medicare says she has to wait until April 1st to sign up for an April 1st effective date. Are there exceptions to this one time? I was told if they wait until the 15th of the month, they could get next month's effective date.
Wow. Okay, I don't understand that one, because you can sign up for Medicare anytime you're actively employed at any point, and you choose the effective date, and it's usually the day after your other coverage started. You wouldn't wait till April 1st to sign up for Medicare to have it start April 1st. Definitely not. You'd want to do that in February, I think, is contact Social Security and get an effective date of April 1st. But if you're coming off employee coverage, you can pretty much ask for whatever effective date you want. There are some exceptions if she's in her initial enrollment period, which is that 7 months around where you turn 65, and she's retiring, and that would be a special enrollment period. The initial enrollment period always trumps the special, so there may be some special circumstances in her case as to when she contacted Social Security and when it will be effective. But Social Security is the bottom line arbiter on when it's going to start.
Okay, what is dual eligible?
Dual eligible means they have Medicare and Medicaid. So a good thing to mention, Medicare-CAID. People get those terms confused often. No more. Now you'll know. Medicare is care, health care for anyone of any income, of any financial circumstances that's 65 and older. Medicaid is, think of the letters aid. Medicaid is aid for low-income people. So could you be 65 and low-income? Yes. Then you could be on Medicare and Medicaid. Medicaid is a financial program. So a Medi-Medi, as they call them, usually gets some special deals, some lower rates. If they're low enough income, below 100% of the federal poverty level, they may get a Medicare savings program called QMB, and that will pay that 20% Medicare doesn't pay, negating for them the need to have a Medicare supplement. So they can have some very low costs. They can have Medicaid pick up their medical costs, and then there's something called extra help with Medicare Part D, which would bring their drug costs down to $2.65 for a generic and $6.60 for a brand name.
Okay, under what circumstances is it advisable to delay Part B? Isn't there a penalty for delaying Part B?
Not if you have active coverage. So as long as you have active employee coverage, group over 20, creditable coverage includes drug coverage, then there is no penalty for delaying for your Part B. And that's why I said in that one slide, active employee coverage by you or your spouse, not retiree coverage, not COBRA, not individual health coverage.
We have just a couple more questions here, so we've actually plowed right through these. The next one I have, when working with clients, do you have a risk tolerance form that you use to guide the discussion?
Good question. I don't have a form. I ask them questions. I usually Xerox out that page of Medicare and You with the flow chart, and I have them write all over it, write premiums and prices and write down questions and things, but I don't have a specific flow chart. That would not be a bad thing to develop. I've never seen one in Medicare. I do it informally with questions. I don't do it formally with a sheet.
Okay, and the last question I have here, I have someone asking, Liz, if you are an agent.
Oh, yes, I am a licensed insurance agent. I thought I said that in the first slide, but yeah. At first when I left SHIP, I did counseling, fee-for-service counseling, and then I developed such a great relationship with people, they wanted to continue and buy the product with me, so I said, okay, and I went and got licensed. Yes, I am.
Okay, great. Next to all of the other comments that we have here on how wonderful this presentation was, very resourceful. Everybody is eager to get their hands on the recorded presentation and the handout. So Liz, thank you so much.